Hello. Hi guys, good evening. I hope you can hear me loud and clear. Can you hear me okay? Good evening everyone. Thank you for joining me once again. Another session um tonight. Let's do some You can hear me okay, yeah? Let's do some what do you call this? Attendance. Let me know on the chat which part of the country you're from or which part of the world you are watching. Hello. There you go. I hope you can hear me okay, yeah? Okay, let's just wait for a couple more people. Hi, Kathleen. Hi, Shelly. Watching from Durham. Okay, let's just wait for Hi, Bella. Hi, is it Vikash? Thank you for joining me again, guys. If you're new to my channel, my name is Emer, and we normally do like a live stream every week. But I know last week we did not do any live stream because I'm still recovering from Kathniel's breakup. I'm afraid when I heard the news. Hi, Edge. When I heard the news, um, I couldn't do the class anymore. So for all those people watching, Kathniel fans, I'm really sorry. But um I think I've recovered kind of. So we are doing our class tonight. So thank you for joining me. Guys, please do subscribe to my channel. We will reach 20,000 subscribers very soon. So please do subscribe, yeah. And please click the notification bell so you know if there will be no new videos. Um and of course if you have live stream, you'll get notified, yeah. So yeah, please do subscribe, and of course, please do follow me on my other social media accounts. On the screen on my Facebook, Instagram, what else? X, and of course on my TikTok account. Thank you for joining me tonight. Katniel fan Shelly, of course. We are still mourning from their breakup. It's an end of a chapter, according to Catherine. So, um, all right. After our class, I will be watching The House of Us. There you go. All right. So tonight we will be discussing the OSCE supporting documents. So I don't know if ever in any of your classes have you ever had a chat about the different supporting documents for the OSCE. So we are doing it here tonight during our live stream. So I will be discussing the different documents involved for your OSCE. So we will be focusing more on the adult OSCE. But of course, I might be able to show some other documents from the other examination. So um, we will now make a start. We will make a start short. Yeah. So guys, for these people just join us. You can type on the comment section which part of the country you're from or which part of the world. I know some of you we are still shocked or saddened by the immigration laws. I know that. So we heard recently about the changes that will be happening. Um, but yeah, according to the news, of course, NHS will not be affected definitely. Um, we will talk about that probably in the next coming sessions. But tonight we will be discussing about the supporting documents for the OSCE. Again, if you're new to here, please subscribe. And we do live stream every week, once a week, like normally Wednesday or Thursday. Okay. Um, and what else? I will be running next year for the London Marathon. Please do, if you can, please donate. I'm supporting Victa. That is our charity for next year. So, if you can, please do, please donate. Yeah. All right. And of course, if you want to watch some of the hidden videos, please join the channel so you'll be able to watch like other videos. All right, we will now make a start. So tonight, let me just grab my glasses because I am blind. All right. So we will be discussing the OSCE supporting document. So Emma, where can we download this document from? So if you go to the test center's website, you will see these documents. Okay. So let's say if you're going to take the OSCE at Oxford Brookes University, you will be able to download this document from their website. If you're going to do your OSCE or you're going to take your OSCE in um, Northumbria, Ulster, Northampton, just go to their website and you will see these documents. I've decided to discuss this because again, probably um, some of you who's watching this video, you're not familiar about this document or you've never seen this before. So I'm really hoping that you'll find our session useful. Okay. So all right, let's make a start. What time is it now? It is time check. It's 10 past 8. Okay. Let's see if we can if I can see it. All right. So, this document is called as the Test of Competence 2021 supporting document. So you might be thinking, why is it called 2021? Because it's the name of the exam. Yeah, it was. I mean, it was. what do you call this? It was published. The new this is the new OSCE, 2021. Or I cannot read it as well. All right, let me just make it bigger so you can see it. All right. So this version, as you can see here, this version is version um is it point 4 updated November 2023. Okay. So last month, okay, so this document was updated last month. It's the supporting document. So guys, just so you know, the documents for the OSCE, it keeps changing. So make sure if you're watching this video in the future, let's say if you're watching this video in 2024, probably what I'm saying now is um no longer applicable or already incorrect. Okay, so please, it's your responsibility to always check for the latest video, and if can, please join our classes so you'll get notified for any um changes. So our class is just study with me, so it's just a chill class. I don't have any presentations. We will just be chatting, and we will just be studying together. Okay, so it's just like an informal class. So if you have any questions, please do type it on the chat box. If you have any comments or whatever, just type it on the chat box so we can discuss it. And if you're watching this video late, of course, if you have any question, just type it on the chat box. I'll try and answer it as soon as possible. Okay, all right. But again, if you can, please do join our live classes so we can answer your questions live. All right. So let's start. So this is of course our. Can you see my face? There you go. I'm trying to move. There you go. I'll move here. Um. So it says here this document contains some supporting documents which may be used in the NMC Test of Competence 21. It is intended for candidates to have the opportunity to become familiar with these supporting documents prior to taking the exam. Okay, so this is that's the purpose of this document. All right, let's start with the first one. So the first document that you can see here is a drug chart. Okay, so this one is a drug chart. For those people who's probably familiar, what kind of drug chart is this? Is this an in-hospital or a community drug chart? What do you think? What type of drug chart is this? Is this a community drug chart or an in-hospital drug chart? What do you think? There you go. That's the end of this document. All right. What do you think? See, let's see. Let's go back. No answers? No guesses? No guesses. All right. I'll tell the answers then. I hope you're still awake. I know probably some of you um you just finished your shift, but if you can try to answer my questions, okay? If not, of course, type it on the chat box if you're watching this video in the future. So, Angeli, is it Angeli? Am I saying it properly? She said community. So, well done. That's correct. So, during your examination, you have two types of drug chart, okay? So, you have a drug chart intended for the community, and of course, you also have a drug chart intended for hospital use. Okay, so I won't be discussing this drug chart in depth because that's not our topic. Okay, so and then of course we don't have enough time to discuss all this. So just remember, I'll just give you some tips. So for community scenarios, you will be seeing this drug chart. So when we say community, can you think of a possible setting? Um, so when you say community, what could be the possible setting you can think of if you put your answers on the comment box or comment section? What could be the possible location? So as you can see, this is how it looks like. It's very similar with the community, with the in hospital drug chart. Probably you're more familiar with the community drug chart. Yeah, this is very much the same. But as you can see here, it's less complicated compared to the in hospital. Yeah, if you can think of what will be the community um locations or scenarios that you can possibly think of. When we say community, where could you possibly be during the exam? Any any answers? Where's my cell phone? Thank you for those people who's watching us this evening. Um, Probably most of you are tired from a shift. Any guesses? So community, probably you're at the patient's residence. Probably, um, there you go. Joanna said, "Is Joanna the Joanna I know?" We've met before, Joanna. Yeah. I'm trying to remember. So, yep, when you say community, you're probably at your patient's um home. There you go. You might be, let's say, you might be in a hotel. You might be in a care home. So that will be your setting. Okay? So those are the possible settings that you might be using this drug chart. Okay? Next, let's move on. So as you can see here, again, if you're more familiar with in hospital, this one, as you can see here, it's less complicated compared to your hospital. As you can see, what are the parts missing here compared to the in hospital? As you can see, there's no part here which talks about or dedicated for the oxygen. Okay, so for the community drug chart, as you can see, there is no page which talks about oxygen. Okay, because normally normally we don't give oxygen in the community. Of course, there will be people who's receiving oxygen at home, but not for everybody. Okay, so not for everybody. Of course, definitely there will be people who will be receiving oxygen at home, but not very common. Okay, not very common. So you don't see oxygen page here. What else? What else is missing here? No section for PRN. Okay, there will be no section for PRN here. So how will that be? So no section for PRN. So how's that on the examination? So the PRN might be just prescribed on this section. Okay, so the regular drugs, the PRNs might just be prescribed on this section, the one on the screen. Okay, it will be just be together. It will just be together compared to your in hospital, which is like there are sections, and each section represents a particular group of medication. Okay, so that's your um, community drug chart. Okay, so remember during the examination, you have couple of community scenarios. So this one might be your drug chart. So please download this document and make sure to familiarize yourselves on this document. All right, let's move on with the next one. Probably this one, you are more familiar with this. So this is what we call the in-hospital or the hospital drug chart. So every drug chart, the topmost section is it talks about the patient. It shows the patient's details such as your surname, the forename, hospital number, or the NHS number. Of course, if you're in the hospital, you will see hospital number. Okay. Um, ward, of course, your date of admission, the height, the weight, the body mass index, consultant, of course, in the time of admission. Guys, please make sure to remember the time of admission, okay? Because you might see that is important, yeah, the time of admission, especially when you're giving medication. Because you might be thinking, why is this medication? I know a lot of you are asking what does X means, yeah? What does X mean on the examination? You might be seeing a symbol X on the examination. And probably one of the reason that you might be seeing X on your drug chart is because during that time the patient was not admitted in the hospital. The patient probably was still at home. Okay, that's why during that time, let's say 2 o'clock in the morning, you saw an X mark written on the drug chart. Because probably by that during that time the patient was still at home. Okay. That might be the reason of the X on your drug chart. I know some of you are actually asking what does X mean on a drug chart. Okay, so time of admission. Probably the patient was admitted 7 o'clock in the morning. So that's why 2 o'clock, the drug chart. I mean, there was a mark X. Of course, it was not given because the patient was not admitted yet. Okay, so please do remember that. Okay. Um. Of course, your allergies, your medication risk factors, it will be written at this section. Okay. What else? I'll tell you something that is really common that I common question. I mean, not common question. Care home, thank you, Eunice. All right. Are you familiar with the bleep? I know. During your practice, you always see the bleep number. Where is it? Um, you normally see the bleep number on this document on the in hospital. So the bleep number, it's like a pager, and it's normally common in the hospital. Yeah, a bleep number, it's like a pager. I don't know if you know what a pager is, so Google it later. So it's the communication device we use normally in the hospital. I know in the care homes you don't have a a, a beeper or like a bleep. Okay, so it's very common in the NHS. Okay, so probably if you're working in a private hospital, you're not familiar with this device. You use a different device. Let's say if you work in a care home, you don't see this device as well. So you might be wondering what a bleep or a bleep number is in your drug chart. Okay, so that is how we communicate normally in the hospital. So doctors, they carry it. Nurses, of course, they also carry it. Some nurses, they carry it as well. Managers, they also carry it. So let's say if I have any question, let's say, doctor, I don't understand your prescription, I could just bleep the doctor so I could easily communicate whoever prescribed that medication. Okay, so that's how it works. That is why if we go back to the community drug chart, that is why the bleep was not there. Okay, instead of a bleep number, what is written? You will see. So you can see here on the screen, it says here bleep because it's in the hospital. If you go to the care home, the community drug chart, you will not see the word bleep. Instead, you will see the contact details. Okay? You will see the contact number as you can see on the screen. Yeah? On the red section, you can see a contact number and a telephone number. Because again, in the community, we use mobile phones. We might be using telephones or landlines instead of a bleep. Okay? So for those people who doesn't know what bleep is. Um, all right. So you can Google it so you can have an idea how it looks like. All right. So next, next document. Do you have any questions for this document? Again, I won't be discussing this in depth because probably next time or next week, if you like, we can do another implementation session on how to read the drug chart. If you fancy, just type it on the chat box. Or if you have any suggestions for topics for the next classes, let me know. Guys, you can watch this video again. And of course, if you want to watch the old live stream, you can just go to my channel, and I think it's called the live classes. You will see it there somewhere. Just search for it. All right, let's move on. What time is it now? It is nearly 8:30. I hope you're still awake. Guys, please do share our live stream, yeah? And of course, do me a favor, please click the like button. So I feel loved during this live stream. And what else? Invite your friends. This one is just for free. And what else? Okay, of course, probably most of you are familiar with this document. You leave, what do you call this? You see this document in your dreams. You breathe this document ever since you started your OSCE um, journey. Okay, so this is our news chart. So this is our news chart. There is a question from Faith. I have three first names. Oh my God, you have a long name. How did you survive your childhood? um, is it okay? Yeah, that's fine. Faith. Faith is asking. She has a long name. Is it possible if she can just write her first name? Yeah, that's fine. As long as you write your name, they don't normally check if you're writing your entire name. That's fine. I also have two names, but I only write my first name. But yeah, I passed. As long as you put your name in there, yeah? Just put your legal name, of course. Do not put your alias. All right. So this is our news chart. I think I have a recording, or I have a video discussing the news chart. So please go to my channel and watch that. Yeah, I won't be discussing this. So probably a lot of people, I mean, during assessment station, probably majority of people are failing that station because of number one, not documenting properly. Number two, not completing the news chart. So guys, please make sure please make sure what do you call this, please make sure to write legibly and complete your news chart. So let's say remember, for your assessment, as of recording, as of our live stream, the assessment station lasts for 20 minutes. So in case you finish that station, let's say you still have 2 minutes remaining or 3 minutes remaining, I always advise my students to please check your news chart, check your documentation. Guys, you don't want to fail because of not writing your name. You don't want to fail because not writing the date, the time, the escalation frequency, um, no, the escalation, is it yes or no, the monitoring frequency, of course, the total news score. Anything missing will be um a fail. Yeah, if there's anything missing on your news chart, that will definitely result into a fail. Um, I know. Have you heard of the OSCE Vivo? Is that OSCE Vivo? Yeah, OSCE Vivo. Vi- Um, so have a look on the website. There is an explanation about that. But again, it depends on the examiner when they will be asking. Let's say you forgot something, you did not finish your news chart, and the examiners want to give you like a chance to amend or rectify or add on to your answers. Definitely, it will all depend to your examiner. So please make sure it will be your responsibility to double check your documentation on the day before you submit or before you finish your station. Question from Faith: do I need to ask the examiner? No need to ask the examiner. Again, as long as you write your name, yeah, um, that is fine. All right. Faith, she said she's binge watching. There you go. Of course, please do watch our videos. Yeah, thank you for watching. Faith. I'm just saying your Faith because I don't know how to say your first name. All right. Okay. So please do watch my video about news. So I think I discussed what news is on video. Angeli, do you provide classes? We normally do a final coaching. Yeah, so we just finished the final coaching. Was it last weekend? Okay, so probably we'll do another one this December. So please stay tuned. Yeah. Um, we normally do like a 2 day final coaching session wherein we discuss this in more depth. So for those people who attended our final coaching, I hope you enjoyed it. Yeah. So type it in the comment section if you attended one of our final coaching. We'll do another one this month. Okay. So hopefully, all of you can join. All right. Next is where we're now. So this one, this document, the back of the news chart, you will see what we call the news protocol or the news policy. Okay. So some of the questions that I normally receive about the news is, do we need to memorize this? Okay. So during the examination, this particular document will be present. Yeah. It will be there. You don't need to memorize this. You can just read this during the day or during the examination. But of course, I trust that the more you practice, the more you, memorize this by heart. Again, you don't need to memorize this document because this part of the news will be given to you on the day of the examination. Yeah, they don't expect you to memorize whatever is written there here. But again, like what I've said, as you practice, the more you practice, the more you memorize what's actually written here. Okay, so I won't be discussing this because we still have a lot of documents to show, right? So, I hope, do you have any questions? Again, you can always download this document from the website. So at least, you know. So I'll just probably give you an information. So during your assessment station, all the documents that you will be completing during your assessment station, you will be using a green pen. Okay, so a green pen. So you will, when you complete your news, when you complete your PH9, your must, your 6CIT, you will be using green pen. So why am I saying that? Because probably if you still have time, probably you can buy a green pen and practice completing your document using a green pen. Why? Because again, of course, we normally use in our everyday life, we normally use black pen to document, isn't it? But of course, green pen sometimes it's not too readable. Okay, so it's not too readable. So whenever you practice, if you can purchase a green pen, use that during your practice. Yeah, so at least you know how it's like on the actual examination, how to document. So if your writing is not too good, at least you can improve on that. Like me, I always tell this during my class, my handwriting is really bad, but during the examination, I made sure I write legibly and clearly. An extra challenge is of course using a green pen. Sometimes green pens are not not readable. Okay. Question from Ding Ding. Is it acceptable if we write only dot or plot, or do we need both? Number and dot. Just clarification. Ding, are you referring to the news? So if you're referring to the news, um just you can just pick, yeah, you can just pick, it's either a dot or a number. Go to my channel, search for the news there. I think I've discussed how to document. Yeah, watch that video. But of course, again, if you want to just use a dot, then that's it. If you want to use a number, then that's it. Okay. Okay, all right. Question from Angeli. Do we need to take pen? Just bring your black pen during the exam, Angeli. So during the examination, they will provide the different colored pens. Yeah, so they will provide the blue pen, they will provide the black pen, they will provide the green pen during the exam. They will not allow you to take tricolored pens. Have you seen those different colored pens? Yeah, they will not allow you to take those pens during the exam because of course they don't want you to change your answers. Yeah, they don't want, let's say, because let's say planning, let's say assessment, and then you go to planning. So planning will be a black pen, yeah, during the examination. So they will be giving you a black pen during planning, so you won't be able to change your answers during your assessment station because when you do your planning station, you have access to your previous documents. Let's say example would be your news chart, your PHQ9, your must, and then because they say planning, you realize, oh my god, I think I wrote the wrong number on my news chart. Or say I placed the dot on the wrong box. You realize that during your planning. You won't be able to change it anymore because at that point you have a different colored pen. Okay, so they will give you black pen. So you don't need to buy it. Just probably I recommend just buy it for you to be able to practice. Yeah, but again, the test center will provide those different colored pens. How did I know it? It's written on your documents. Yeah, if you read your OSCE documents, it's written on the instruction what pens you're gonna use. Okay, so Michael he's asking final coaching 17 or 16. I will try. Yeah, it will be normally it's normally weekend, but let's see if we can. Let's see if we can. All right, let's move on. Just throw your questions on the comment section, yeah? If you have any question. Thank you for those people who's watching us. And again, if you're new to my channel, my name is Emer. We do live stream every week and please do subscribe, yeah? Let's reach 20,000 followers by the end of this year. Yeah, we're nearly there. Um I still remember last year, we only had like 1,000 subscribers when we started our OSCE channel. So, I mean my channel. But now we're nearly 20,000. So thank you for those people who subscribed to my channel and has been watching ever since. This one, I won't be discussing this. This is what we call the pews. Okay? This is the pews. It's for pediatric nurses. This is the equivalent of the news for children. Okay, so I won't be discussing this. So this one, the one on the screen, probably on our actually I was actually planning on discussing the neurological assessment today, but again I only have very short time to prepare for the class. So probably next time we will discuss our neuro assessment next time if you like on how to perform the GCS. If you like that, let me know on the comment section. Probably we can do that next week or next week. Okay, so this is your neuro assessment. So please make sure to know this, practice your GCS. So there is only one scenario that you will find this. It's normally you will only complete this during your subdural hematoma scenario. Okay, that's the only station um as of um as of recording, again as of live stream, that's the only station that you will be performing this. So question, Emmer, do we need to perform news on top of the GCS? You will not be performing news, you will be performing the neurological assessment, plus the vital signs, okay? Plus your regular vital signs such as your blood pressure, your pulse rate, etc. All information will be recorded on this document, yeah? All information will be recorded in this document. Some stations, some stations, some scenarios, it will be paired with let's say what do you call this? It will be paired with an assessment tool, but not all scenarios. Let's say there are scenarios that you will be completing news only. There will be scenario that you will be completing news plus must, or let's say news plus um PHQ9. But this one, the neurological assessment, it's the only document you have to complete during assessment station. Okay. Um. All right. Just make sure to document properly. Okay. Let me zoom in if because I have a question. Yeah. Since we're talking about documentation, I don't know if you can see this clearly on your screen. I'll make it bigger. Hang on. Give me 1 second. Let's make it bigger. Or if you have a copy on your in front of you, um grab it. Let's see. It will cover it. It will now cover my face. Okay. Let's see. All right. Are you ready? Where's my face? Okay. There you go. It's bigger now. My face is covered, but I, yeah, I'm here. I'm just behind the. I'm just behind the document. Yeah. All right. So I have a question. Let's make it a bit bigger. All right. So because I normally discuss this during our final coaching, but since we're here, I'll give you some tips. Okay, I'll give you some tips. I'm just behind. I'm just behind this paper. Yeah. I have a question. If you can help me, I don't know how am I going to show it on the screen, but let's say because you don't see my mouse is moving, isn't it? You don't see my mouse moving. Let's say the patient's, yeah, it's for you to answer, yeah, tonight, or write your answer on the comment section. Okay. So what if the patient's, let's say, pulse rate is 65? Okay. Can you see it? Can you see the screen? Okay, I have a question. What if your patient's pulse rate is 65? Okay. Where are you going to put the dot? Okay, that's my question. So you can see the screen, yeah? I cannot show my I cannot draw on my screen. I'm really sorry, but try to think about the answer, yeah? What if your patient's pulse rate is 65? Which box are you going to document? Yeah, so that's our um that is my burning question this evening. What if your patient's pulse rate is 65? Which box are you going to put the dot? Okay, so let me know your answers on the comment section. Yeah, so if you're watching this live stream late, just type your answer on the comment section. I will put the answer there. Probably you're thinking, Emma, that's easy. I can question your answers. Yeah, try to think where you're going to put the dot. Okay, is it above the 60? I mean, is it above the line? Is it above the line? Is it the box above 60 or the box above 50? Okay, that's my probably your choices. A, is it the box above 60, or B, is it the box above 50? Or Samantha said on the line between 60 and 70. On on the area between 60 and 70. Okay? So do we agree with Samantha? What do we think? Okay? So are we going to put the dot in between 60 to 70, or are we going to put the dot between 50 and 60? Or is it are we going it on the actual line? Yeah. So try to think. Yeah, try to think. So your assignment would be, because it's hard to on the box above 60. Do we agree with Samantha? Okay, so try to think. Yeah, so if you can grab your own GCS chart and try to plot it. Okay, I will give you a hint. The first box, it says here 20. Yeah, the first box, it says here 20. If you're going to analyze this, the first box is 0 to 20. Yeah, the first box is equivalent to 0 to 20, which means the next box corresponds to 21 to 30, and so on. Okay, so that's the hint to know the appropriate answer. Because surprisingly, a lot of people are still confused, yeah, where to document, especially for the GCS. Yeah, so especially for the GCS. Probably we can discuss this next week on our next live stream if you want. So please put it on the comment section. But that will be your assignment. Try to find out where to put or where to document. All right. I'll put my face back on the screen. There you go. Um, I know you don't want to see my face, but I'll don't have any option. You don't have any choice. All right, there you go. I'm back. Okay, I'm back. Okay. Try to, again, that will be your assignment, everybody, children, that will be your assignment. Put your answers on the comment section, yeah? Or probably we can answer that next week. Oh, my hair is bad. Okay, let's continue. All right. So next document, this is not yours. This is for midwives. Am I correct? Oh, I cannot see it. It's for midwives. It's our meows. It's like a cat. Yeah, there you go. It's our meows. It's the equivalent of news for pregnant women. All right. Next is what other documents? So for adult nurses, you don't need that the meows. It's for midwives. Of course, if there are any midwives watching our live stream, this is for you. This one, what is this? Our Glasgow Depression Scale. This one is for our learning disability nurses. Yeah, learning disability nurses. For learning disability nurses who's watching this video, um, go to I will promote it now. Go to Learning Hub. Yeah, search Learning Hub on your Google, and then look for learning disability OSCE. So I have created an entire course for learning disability nurses there. Yeah, so if so, just register using your hospital email. Yeah, so any learning disability nurses who's watching here is planning to come to the UK and work here, go to learninghub.com and then create your website. It's an NHS platform. Yeah, search for learning disability OSCE, and then it's for free. Yeah, I've created a course for learning disability nurses, so you can watch all the videos for learning disability there. So this one is for learn disability. Don't worry about this. You don't need this for adult nurses. Yeah. 6 CIT, of course. This is our one of the newest documents for the examination. Of course, you will see this during your Alzheimer's or dementia scenario. Yeah, so you will see this during your Alzheimer's dementia scenario. So please familiarize yourselves with this document. Probably in one of our sessions, we could possibly, hi Mary Lou, from where is this place? I'm not familiar. Yeah, but familiarize yourselves with this document. Yeah. So probably one of our sessions in the future, well, we can talk about our 6 item cognitive impairment test. So next year we're planning to do a class, another webinar. If you're familiar, yeah, remember was it last year or last year we did webinar under the Philippine Nurses Association. But hopefully we'll do it again next year because we're a bit busy because of course it's Christmas season. So hopefully we can discuss it during one of the classes. Or if you want to join our study with me every week, probably this one you can suggest if you want to discuss this in more depth. Next is our PHQ9. This is the questionnaire. This is the document that you will see during the depression scenario. Okay, during the depression scenario, this is the document you will complete. Okay, so this document, it's also, I mean, for of course for adult nurses, you will see this document. For mental health nurses, of course, you will also see this document during your examination. I think for learning disability, it will be part of a scenario, of a skill. Yeah. So there you go. So mental health nurses and adult nurses, this is one part of your assessment station. And of course, familiarize yourselves, guys, with your PHQ9 interpretation. Yeah. So make sure during your examination, if you will be getting the scenario, you have to interpret the score, and of course, you have to give the treatment recommendation. Again, you don't need to memorize this because this particular table will be present on the day of the examination. Of course, you need to study what this means, yeah, the meaning of this table. So my only question is, this is your assignment, yeah? I will not be discussing this today, but probably one of our classes. Why do you think there is no zero? Have you ever thought about this? The scoring, the lowest possible score for PHQ9 is 5 to 9. Have you ever thought or have you ever noticed that information that there is no 0 to 4? Yeah, so that is your assignment. Why do you think there is no 0 to 4 on the PHQ9 scoring? Okay, so why do you think there is no 0 to 4? That is your assignment. Probably we'll discuss it in one of our sessions. But yeah, have a look. Have some Google. Why is 5 the lowest score for PHQ9? All right. Next is must. This the must document. This particular must. You will see this during the assessment station. Remember, you have another nutritional assessment. Later, I will show you the document. So this one, you will see this document during the assessment station. So one of the documents that you have to complete during your malnutrition scenario or your malnutrition and diabetes scenario. Okay, so that's your scenario, malnutrition and diabetes. So you will be completing the must. Okay, so familiarize yourselves. Um, I'll just give you a tip. The first, the first table or this first section, I don't know. Yeah, you don't see my mouse moving. So the top, the table, the first table, it's pre-populated, so you will see the patient's details there. You don't need to complete it, yeah, but of course if it's blank, um supply the necessary information, but during the examination the top section will be completed. And of course, please study your 5 must steps, yeah, so step number 1, step number 2, step number 3, step number 4, step number 5, your recommendations. Okay, so please do study that. Again, I won't be discussing this in more depth because we still have a couple of documents we need to show. If you have any question, please type it on the chat box. Probably again, we can we can we can allocate one of our live stream sessions discussing the must and probably the nutritional assessment. I know a lot of you were asking about the nutritional assessment. So this is our latest must tools. So during your assessment station, you will also see this table or this diagram. Okay, it was green before, but the new update is it's now white. Okay, yeah, it was green before this document, but now it's white. All right. So for the must, remember there will be, if you're in the hospital, I mean the intervention for the hospital, for the community, and for nursing homes will be different. Yeah. Again, remember this, the intervention for the hospital setting, for the community, for the care home will be different. All right. Oral assessment. So oral assessment, you will see this particular document during your oral care plan. Okay? So oral care plan. This document will be pre-populated or there will be details here, and then you will be using this, of course, as an evidence of your, I mean, as a source of information to create your care plan for your patient. So remember, for oral care, if we recap, if you haven't started your study for oral care, there will be 4 scenarios there, okay, and you will be given 1 out of 4. Yeah, 1 out of 4. So what are the scenarios that we have? So we have your end of life, we have your patient with ventilator, what else, patient with learning disability. I'm missing something. Yeah, I'm missing something, one scenario. Type it on the chat box, what did I miss? So those are the scenarios, and you will be given 1 out of 4. Okay, so you will see this diagram. So of course, here you will see the total score at the bottom. So the total score, there you go, here, as you can see on the screen. So you will see answers, and of course you have to interpret the answer. Um, to summarize, I mean, this tool, not summarize. The higher the number, the poorer the oral health of the the patient. Yeah. If the score is lower, it means the patient's oral health is good. Okay, the patient's oral health is good. Okay, if the score is high, it means the patient's oral hair health is poor or bad. Okay, because let's pick one: gums and tissues. Yeah, as you can see, 0 if it's pink, moist, smooth, no bleeding. 2 if it's swollen, there's bleeding, ulcers, white, red patches, generalized redness under dentures. Okay, that's why if the patient score is high, it suggests poor oral health. Okay, so please do have a look. Okay, this one, the next document, this document, you will see this during your peak flow. Okay, you will see this during your peak flow. So this is the normal values of peak expiratory flow, or your PEF. Okay, so you will see the patient's name, date of birth, and address. So make sure, guys, when you do your peak flow, you have a conversation about your patient. It's important you identify the normal value for your patient. Yeah, you need to identify the estimated normal value for your patient before you start your peak flow. Okay, so I hope you know how to use this. Yeah, I won't be able to show it on the screen, but let's do an example. I don't know if you can see it clearly on your screen. I don't know if it's big enough, but I'll say some numbers and try to identify. If you have a copy in front of you, try to identify the normal value. Yeah. So what if your patient is sorry? So what if your patient is female and the patient's age is 45? Yeah. The patient's height is 152 centimeters. What is your normal peak flow value? Again, the patient's height, no, the patient is female and the patient's age is 45 and the patient's height is 152. What is the normal peak flow value, or the estimated normal peak flow value for that patient? Again, the patient is 45 years old, 152 centimeters, and the patient is um, a female or a woman. What is your expected peak flow values? I don't know if you can see it, but for those people who's probably watching this late, just of course pause this video and then look for your um the values. Yeah. Well, just waiting for your answer, I'll give another one. Yeah, I'll give another exercise. What if you have a look, yeah, and then tell me the answer on the comment section. Another one. What if your patient is a man and the patient's age is 70 and the patient's height is 175 centimeters? What will be your normal peak flow value? Michael said 410 for the first question. Do we agree with Michael? Okay, so put it on your comments on the comment section. I hope you know how to um, identify or locate the normal peak flow value. Again, what did I say? It's a man. The patient's age is, did I say 70? And then the patient's height is 175 centimeters. The second exercise, yeah? So the patient is a man, the patient's age is 70, and the patient's height is 175 centimeters. What is your normal peak flow value for that patient? Okay, so that is another one. Pause this video and then look for the answer. Okay, so just follow the graph. So as you can see, um, the x-axis, are you familiar with the x-axis? Yeah, the x-axis is your age, and then the y-axis is your the value, the height rather. Yeah, the height. And then on the left hand side of your screen or your tool, you will see the expected normal value for your patient. Try to answer the second exercise as well. What if your patient is a man, the patient's age is 70, and the patient's height is 175 centimeters? So what will be your normal value? Write it in the comment section and then we will check your answer. Sorry, I cannot read it as well. My eyes is really small. Okay. All right, let's move on. Okay. Do we agree with Michael or do we agree with Samantha? So next is your pediatric normal values. Again, if you like, probably in the next session we can focus more on peak flow. Yeah, and then this could be one of our conversations on how to check the peak flow value. So please do practice it. Grab your own document and let's see what is your normal. What is the correct answer? All right, pediatric normal values is for pediatrics, of course. um for nurses who will be registering as pediatric nurses, definitely this will be your peak flow value. So the one on the screen is this is the picture of your peak flow meter if you haven't seen one before. This and that, this is for your learning disability nurses. Yeah, this is your distress and discomfort assessment tool. Again, for any learning disability nurses who's watching this video, go to the learning hub, search for learning disability. There is an entire course there for free. Yeah, we've created that in partnership with NHS England London. It's for free, so you can see me there discussing this. All right, and it's for free. um All right, so we will skip this because probably most of you are adult nurses. You don't, this is not your exam. And this is your universal pain assessment tool. Probably you've seen this. You will see this document during your pain assessment station, of course. Let me ask you guys, what other pain assessment tool do we know? Apart from the universal pain assessment tool, what other pain assessment tool are you familiar? Just a question. Yeah, it's not part of the examination. Just a random question. Apart from this, what other pain assessment tool do you know? For people who's working in care homes, you know there is another pain assessment tool that you normally use there. What do you call that? For nurses, pediatric nurses, what do you call your, I mean, your pain assessment tool? Do we know? Apart from this, what other pain assessment tool we know? We know of? No one? Let's see. So hopefully someone will comment on this comment section. Okay. What other pain assessment tool? But this one definitely you will see this during your pain assessment. It's your numeric scoring. Yeah. So 0 to 10, 0 the least or no pain, and 10 is the highest possible pain ever. And of course you will see the photos. This one, you will see this document during our Braden. So if you haven't watched our recording, so we had a dedicated live stream before for Braden. I hope you enjoyed that. Yeah, so you can search that video on my channel. We discussed this in more depth. Yeah, so please go to that recording and watch it again. So we did couple of scenarios there, and then of course try to practice and exercise those exercises. Yeah, so hopefully you'll get the correct answers. Yeah, so we had a dedicated video for that. Fluid balance. So fluid balance, surprisingly, of course, I mean, there are also people who's failing the fluid balance station. Probably one of the easier stations, but again, there are still people who's failing this. Because I know definitely because of the anxiety, etc. They fail. So question. This is of course one of the, I mean, questions that I get for fluid balance. Okay, help me with this. Okay, let's say the doctor ordered, um, let's say the physician ordered 1,000 ml of sodium chloride. Okay, to run for, let's say, um 1,000 ml, yeah, of sodium chloride to run for 4 hours. Okay? What will be the ml per hour or the mils per hour? It should be a basic math, yeah? That's my first question. So, 1000 mils of sodium chloride to run for 4 hours. What will be your mils per hour or ml per hour? Let's see if you're still awake. I'll wait for your answers before I proceed with the next question. Probably some of you are anticipating this question already. So again, thank you for watching our live stream. Again, you can still watch this live stream later, and you can watch the old live streams on my channel. Of course, please do subscribe, yeah, and click the notification bell so you'll get notified whenever we go live. And of course, please do follow me in my social media. It's all Emer Diego across social media platforms. Thanks, Dwight, Michael, yep, and Faith. So the answer would be 250 mils. Well done. Okay. Next part of the question. So the doctor asked you to start the IV fluid at 8 o'clock. Where will you start documenting 250? At 8 o'clock or at 9 o'clock? Okay, so this is always the question. Okay. Thank you for those people who's answering my questions. So again, we determined that the IV fluid is meant to be given 250 mils per hour. So the next question is, let's say the doctor or the physician said, please administer or start the infusion at 8 o'clock. Which box are you going to document the 250? Is it at 8 o'clock or is it at 9 o'clock? Okay, so that is the burning question for this station. I know a lot of people are confused with this question. Okay, so the doctor said, start the infusion at 8 o'clock. Is it 8 o'clock or 9 o'clock? Okay, so for those people silently watching, try to answer in your mind. So some people I can see on the chat box, some said 9, some said 8 o'clock. All right. So what would be the correct answer? So the correct answer is, drum rolls please. Definitely you will be writing 250 at 9 o'clock. Okay? It's 9 o'clock. Why? Okay. Let's try to um analyze why you're going to put 250 at 9 o'clock on that box instead of 8 o'clock. The reason for that is, of course, at 8 o'clock, how many meals have you given? It will be 0. Okay? Although the doctor said administer 250 at 8 o'clock, at that time, how many meals have you given? 0. Okay? So probably from 8 o'clock till 8:59, you've only administered less than 250. Probably 248, 249, around that um amount only. Okay? So you will achieve, or you will fully deliver 250 when you reach 9 o'clock. Yeah? Are we following? I hope that's clear. That's why the end time will still be the same. Let's say start the fluid at 8 o'clock, and of course discontinue the fluid at 12 noon. So how many hours did you give it? 8, 9, 10, 11, 12. So 4 hours. 1,000 mils divided by 4, it's 250. Okay? So because normally when we count, we don't count 8 o'clock in it. We don't count 8, 9, 10, 11, 12. We count 8, 9, 10, 11, 12. So hope that's clear. Again, to repeat it, of course, at 8 o'clock, you've only administered 0 mils. Yeah? So 8 o'clock until 8:59, you've only administered less than 250, probably 240, 240, um, what do you call it, 43, 244, but not 250 yet. Okay, so you will only reach that when you reach 9 o'clock. So hope that is clear. Okay, fluid balance. Okay. Um, Hi, Rachel. Hi, Christine. Thank you for joining us this evening. And of course, thank you for those people who's watching us since we started. Okay. And of course, thank you for subscribing to my channel. Commercial. Please, if you can, please donate to Victa. I will be running next year at the London Marathon. So I'm supporting Victa. That it will be the charity. So all donations will go to that charity. Okay. Um, all right. Okay. So the VIP, this one, the VIP chart, you will see this. Um, the VIP chart, you will see this during your IV. Yeah. So during your um, um, flushing of your cannula. Yeah. So you will see this. Of course, you don't need to memorize this. Normally, it should be there during the examination. But I'll give you a tip. Yeah. So you don't need to memorize this. So during the examination, most likely you will just get um, a VIP score of 0. Yeah, possibly 1. So Emer, why 2, 3, 4, 5 um are not possible during the examination? Because remember, if you get a VIP score of 2, 3, 4, 5 during the examination, what will you do? It says there, recite the cannula. So you will not be able to flush or administer your IV medication because, of course, the next action would be to remove the cannula. Okay? So again, it's less likely you will see a score of 2, 3, 4, or 5 during the examination because you it will not allow you to give the medication because again the next action would be to take out or to remove the cannula. So the only time you will be able to administer the IV medication is if the patient's VIP score is 0 or 1. It says there observe cannula or observe. But normally in real life, yeah, in real life, if there are any signs of phlebitis, we normally don't give it at all, isn't it? Let's say there's one sign of of phlebitis, let's say redness or there's pain, we don't normally proceed. So most likely on the examination, you will just see you will just get 0. Of course, I cannot promise. Use your critical thinking and common sense definitely, but just a possibility during the examination because again you won't be able to administer it if the VIP score is more than 0. Okay, so please take note of that. Okay, as a tip for the exam. Question from Faith. Just want to confirm if there's input. So Faith is asking if there's input at 9:30, where do we place it? 9 will be fine, yeah, because 9 will be 9 to 10. That should be fine, yeah, 9 to 10 because the box is 9 to 10. Okay, it will be 9. Next is our this document you will see this during your bowel assessment. Yeah. So during this you will see this during your bowel assessment. So question, the lower this is your Bristol stool chart. So the lower the number, what does it suggest? If the number is low, let's say 0, there's no 0. Yeah, 1, 2, 3. What does it suggest? Is it constipation or diarrhea? If it's type 1, type 2, type 3, what does it suggest? Is it constipation or diarrhea? And of course, if the number is high, what does it suggest? Let's see your answers. So, and of course, I was informed during the examination. I know if you watch my old recording of this, it says probably like a drawing. But according to some people, who had the examination, they were given an actual photo of a poop. Yeah, so you might see an actual photo of a poop or a stool during your examination. Yeah, so the lower the number, it's just constipation. Of course, the higher the number, the type um, it suggests diarrhea. Okay, so type 1, as you can see, um, it's this one, yeah. The you cannot see my mouse moving. So type 1 suggests constipation, 7 suggests diarrhea. So of course you have to put your date, your time, and of course you select which type of stool you are seeing. Don't forget the comments. Yeah, so the comments here you can write whether it's small, medium, large. There is presence of blood or mucus, and of course you have to put your initial. That's it. And of course you have to create your interventions. Yeah, remember there will be interventions. So you will see the answers on your marking criteria. So please go to the document. You will see the possible answers. So if your patient is experiencing diarrhea, what will be your interventions? If your patient is experiencing constipation, what will be your intervention? Okay, so everything, all the answers are written on your marking criteria. Of course, the first step is to identify what type of stool the patient is having. This is your blood glucose monitoring. So you will be getting the patient's blood glucose, yeah. So this will be the document that you will be completing. So you have to put, of course, the date and time, and of course, the blood glucose. It's millimole per liter, and of course, you have to put your name and of course your signature. Okay, so this is your documentation for your blood glucose monitoring. I hope you're enjoying our session. Yeah, I hope you're learning something. Okay, um, probably most of you or some of you, you know this already, but probably some of you are just starting um studying for the OSCE. So I hope you find our session today useful. Of course, again, I always emphasize this. Always visit the website if there are any changes. Yeah. So um, the document I'm showing in front of you, it's version 0.4. Is it 0.4 or zero point 0.4 or 4? This was published November 2023. So this is the latest criteria uploaded on the website. Again, all the documents are similar across test centers. So if whether you're taking it in Oxford or Northampton, um, you have the same document. Of course, you have different examiners. Where are we now? So next is our um, before we call it a night. What time is it now? We're nearly there. So next is your midstream sample of urine. So this is the documentation. Yeah, this is the documentation for midstream sample of urine. So you will here compared to the old, because there was an old version of the documentation before, you only need to tick, yeah, there will be boxes and you have to tick um, what the result is based on the color. So here you need to write, yeah, again in the old documentation for midstream of urine you have to tick, but now on the latest version of the documentation you need to write the value. Okay, you need to write the value based on the color of your strip. Um let's say protein. If the answer on the examination is positive, then you have to write the positive sign there. I know this is the one of the question. Emma, do we need to spell it out? Just put the sign. That will be fine. Because if you think about it, what if it's plus 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 plus? Okay, will you write plus 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 as a word? Yeah. So don't make it complicated. Yeah. So don't make it complicated. So if it's plus, just write, or yeah, just write the symbol plus. If it's plus plus, then write the symbol plus plus. Yeah, you don't need to spell it out. If it's positive, then a positive sign will be fine. If you want to spell positive, why not? Okay, I'm not saying it's wrong. Okay, all right. So please do get familiarized, yeah, with this documentation. I cannot tell you more about this because I normally say it during the final coaching, yeah. So please do attend the final coaching if you can. So we'll do another one this month. I'm just checking my schedule, so that's why we don't have any dates yet. So you can go to Eventbrite Of course, search for my name there. You follow me there, so at least if there will be any published event, you'll get notified. Of course, follow me on my social media because I know announce it there. Nutritional assessment. So this one is for your nutritional assessment station. This will be the documentation. Um, of course, familiarize yourselves with the different must steps. Yeah, you have to put the score. It says here, step number one, BMI score. Step number two, weight loss score. Number three, acute disease effect score. Number four, overall risk of malnutrition score. Okay, so you will be writing the numbers here. Okay, so for step number one, you will not be writing the actual BMI of the patient. What they want is the scoring based on your must stool. Yeah, so please familiarize yourselves with the must steps. So the must tool will be present as well here. You don't need to memorize it. Yeah, it will be here. It will be available, accessible during this station. So prescription, this one is an example of your prescription for the community. So again, this is an example of a prescription for a community medication. So the one on your screen, you can see it's a prescription for inhaled medication. Yeah. So this is your um, prescription. This will this prescription is also kind of similar if you're giving IM. Yeah. So if you're giving, let's say, your vitamin B12, this is the same documentation, kind of similar documentation that you will see. If you're giving subcutaneous injection, this might be your document as well. Yep. So if you're in the community, this is a community drug chart for the skill. Okay. So again, this is a community drug chart for the skill. So as you can see here, it's your inhaled medication. But of course, it will be similar for IM and subcut if you're giving it in the community. All right. So this one, what's this? Not this one is not yours. It's for the midwives. So any midwives in the call, that will be one of your documents you have to study. This one, yep, I think we're nearly there. Is that it? That's the end of our document. Yep, I think that's it. That's the end of our document. Okay, so before, I hope you enjoyed our session. Do you have any questions? So before we end our class, Um, do you have any question? Type your questions on the comment section, and I hope you enjoyed it. Yeah, it's kind of boring our class today, but yeah, I hope you learned something. So please do access this document. It's publicly available. It's for free. Just go to your test center's website. Yeah. So any questions before we good night? Good night. Before we say good night. Yeah. Before we go to sleep. Is it bedtime for most of you now? Probably for some. Any questions? Let's any question in any stations. We still have couple of minutes before um we close our class this evening. If you have any question, just type it in the chat box. Let's see if I can answer your question. Okay. If not, I will find out the answer. All right. Any questions? So, um, you don't have any questions, so anyone taking the examination this week or next week, yeah, so of course major shout out to those people who will be taking their examination very soon. Good luck, yeah. Don't complicate the exams. um Relax. Of course, that's easy for me to say, but I know you're nervous. Yeah, I know you're nervous. Just believe in yourselves. You can do it. Samantha, can you tell me when is your Can you tell me when is your next live session? I will announce it next week, but normally it's a Wednesday or a Thursday. Yeah. So same time, 8 o'clock in the evening, because yeah, 8 o'clock in the evening. We normally do it. So if you want to watch our old recordings, you can just go to my channel. You will see all the old videos in there. Yeah. So I hope you enjoyed our session. Any question? No questions. And of course, If you want to suggest a topic you want to discuss next week, let me know. Of course, in the comment section. Please do subscribe, click the notification bell, and of course, please do follow me on my social media accounts so you will get notified for any updates. I will post a video. I know I haven't posted like video for ages. Yeah, so I will put a video soon out because I don't know if you've seen it. Yeah, I went to the Buckingham Palace. Yeah, so I will share my experience there. I met the king. Yeah, if you were not following me, I met King Charles. So there will be a vlog coming out very soon. I'm still editing it. That's why I haven't published it. I'm busy in the last few days. But yeah, you will hopefully you will be able to watch that video. And if you don't have any question, guys, good luck on your examinations. For those people who will be taking the examination in the future, keep keep joining our class. It's for free, and of course, hopefully, I'll meet you very soon. I met a couple of you guys last when was it last week when I attended Manong George's event. So, thank you for those people who said hello to me, who recognized me during the event. So, they said that they watch my video. So thank you very much, guys, and of course, good night. Yeah, see you on the next one. Good luck, everybody, and I wish you all the best. Good night, good night, good night.